My name is Dr. Josh Funk. I'm the founder and CEO of Rehab to Perform. We are a 63 provider PT practice outside of the nation's capital in the DMV. We currently have 10 locations, soon to be 11 and 12 in Maryland and Virginia. Prompt has helped modernize Rehab to Perform by creating a tech-enabled company that was largely once reliant on people and now has a lot more technology, hardware, automation, things for patients to self-service throughout the course of their patient experience with us, and overall creating a much more seamless and efficient workflow. Efficiency is a word that comes to mind when I think of what Prompt has done for our team, whether or not it's the patient-facing elements or the things that the front desk is touching, back office team, clinicians. Things are getting done quicker or more work is getting done in a certain amount of time. And honestly, as a result of some of the automations and the task flows, we've actually been able to decrease our non-provider FTE count, switching from about 2 front desk people for 4 to 5 PTs to largely a situation where we can operate with 1 to 4 or 1 to 5. And that's put ourselves in a situation where we've been able to compete more with regards to the wage increases needed for PTs. If you're on Prompt, you definitely need to be using the online scheduling function. You will need less people to potentially answer your phones, check emails, check messages. You're in a situation where the patient can serve themselves. If you can think when a patient is calling an office to potentially schedule, they're ready to complete that task at that given moment. They don't want a voicemail back. They don't want to play phone tag. They don't want to potentially wait around. And it could be the difference maker between your business either getting that new patient or having them choose elsewhere. At this point in time, we've done a good job of really creating an ecosystem, pushing patients into self-service scheduling. And last month, we're at 35.6% of our visits, which actually is almost 4,000 visits a month at our practice, that are scheduled entirely online. Biggest feedback from our therapists is that it is easier to get initial evaluations and follow-up notes done. It's leading to less missed notes, less checking of people's work throughout the course of the week, which obviously leads to less of a burden for some of our supervisors and our leaders, and really allows us to be in a situation where we get to focus on what we really want to focus on, which is patient care. I would recommend Prompt first and foremost for the customer service, just the ability to not only have tech improvements regularly at your disposal throughout the course of the year, the months, the weeks, but having a team that works lock in step with you on making sure that you are implementing in an efficient manner, working through different pain points, and ideally really invested in your success. I mean, that is a difference maker. It's one thing to have technology and to have all of these bells and whistles, but it's a whole nother thing to have a team that's fully invested in your practice's success.